We're here today with Shelly, who somehow has been a dental assistant for 28 years. She must have started when she was 8. But she's been a dental assistant for a very long time, and then graduated to lead dental assistant, and then the last year maybe moved up front.
Yes, sir. Yeah,
Okay.
but,
Okay, so now she's been up front and assistant manager. Yeah,
I
assistant
think that,
manager.
I'm not too sure, but yeah, kind of doing it all.
So assistant manager now up front, and then with the large focus on treatment plans.
Yes, sir.
So I really wanted to focus today on treatment plans as much as we can, because she has a very unique perspective working in the back and then in the front, and I think it can help a lot of people. But let's just start with how you got into dentistry.
Well, when I graduated high school, I wasn't too sure what I wanted to do. And my father did not want me just kind of, you know, figuring out life and not really knowing what to do. And he had read an article in the newspaper when we read newspapers that said that assistants at some point were dental assistants were going to put hygienists out of business. Because I think first I was thinking about possibly doing hygiene. And he was kind of like, well, no, this article here says that, dental assistants eventually is going to, put hygienists out, and hygienists are going to be the way of the dodo. That was the terminology. And so he was like, I think you should look into this and, and see what you think. And I was like, okay, I've always been really good with my hands. So it was something that I was like, I'll give it a shot. Needless to say, hygienists are running strong still, and that never happened. But I was happy, I think, that I went into the assisting instead of hygiene, because assisting was more versatile. It wasn't as monotonous as just, cleanings and just cleanings. I had a little bit of everything, extractions, crowns, root canals. My personality is not one to kind of just sit and do just one thing. I like a little bit of diversity in my day. So that kind of worked.
Was that because assistants were at that time able to do more at some point? Did something change?
I honestly, I could not tell you why. Are you speaking of like why they never put the hygienist out of?
Oh no, why the article thought.
I have no idea.
Okay.
It was the Orlando Sentinel, and this was back in 1997 that, it had came out. And so I really couldn't tell you why. I think it was because maybe a lot, all the expanded functions that an assistant can do, and a cleaning would be just one other function, I guess, that they would be able, that they would have to learn, be certified in, and do. That's my thoughts on that.
Yeah.
But I don't really know why.
Okay.
So
this was in Orlando at the time?
Yes.
Okay. And then did you go straight to a private practice?
So when I first got placed in an internship when I was in school, and it was off of Conroy and Kirkman, and it was owned by two doctors, Dr. Moody and McCulka. They were great. And it was a small, I think it was 2 chairs. It was 2 chairs. Each doctor had their own chair, and they had one hygienist.
Oh, wow.
And so I started there, and it was really nice. I learned how to read we used to dip x-rays there. We didn't have like processors, so I had to do like fixer, developer, and all that. And I spent a lot of my time doing that. Matter of fact, now that I think about it.
Right.
And I was there maybe, I want to say, maybe 2 years. And I was new. And one of my coworkers that I worked with, she had left and went to Celebration Dental. And she was there maybe for about 6 months. And then she had said, hey, I spoke about you. I think you'd really like this. It's, it's a large practice. The corporation was called Gentle Dental back then. And, I felt kind of bad because these were the guys that hired me under my internship. But, I was living on my own. I was like, and I needed money, and I was getting, a pay raise, if I was to switch, because it was a larger corporation. And I went and I did it, and they're still there in Celebration.
Oh, really?
It's in the Celebration Hospital, actually. And there I worked with like 5 doctors.
Wow.
And there was like a specialist, an endodontist. They had their own oral surgeon, and then an orthodontist and 2 general dentists and stuff. And I was there up until I got married and moved. So I want to say maybe another 2 years, 2-3 years.
And that's when you started at the private office after that?
So then I moved to Port St. Lucie, and I worked at a private practice there.
Okay.
And I was there for 3 years, worked for an orthodontist, and he was a general dentist, but an orthodontist on Wednesdays. And I was with him until I became pregnant, and then I moved back to Orlando so that my mom can help out. And then that's when I started at 5 Star Dental.
Okay.
Yeah.
So what were the major changes then, going from the larger practice down to, it was a single doctor, 2 assistants, 2 hygienists, to what was it like operationally, the difference?
So from going from like Celebration Dental, it was very, very fast paced. I like fast pace, so that was okay. But it was kind of like a factory per se. It was really just kind of get them in, get them out, get them in, get them out. I was very new in my career, so it was just kind of like follow the rules and just kind of get them in, get them out.
Right.
I didn't want to get really reprimanded for sitting and talking a little bit too long with a patient, which I've always loved talking. Ever since I was in grade school, the teacher would say that they could hang me from the ceiling and I would find someone to talk to. And so, it kind of benefited me in I felt like in the medical field, because people, when they come, they're nervous, right? They're scared. They, they're just on edge. And so if you can kind of chisel that away and just talk to them about anything, it doesn't even have to be about the dental, or the medical, they start to feel like, oh, okay, they're not just looking at me like, an insurance card or, a money.
Right.
But I wasn't really able to do that there. When I would sit and talk too much, I would have, my lead kind of walk behind and be, like this. And, the doctor would kind of be like this. So I just did as I was told. And, that made me not really like, that high pace, fast, corporation, essentially in dental practice.
Right.
So,
did you feel at the private office that, like, since it was smaller, was it more intense? Like,
the
was
smaller
there more
one,
on you?
the smaller one when I first started.
No, 5 Star.
5 Star. No, because I feel like since I was able to go ahead and juggle at that time the other doctors and all the different rooms,
Right.
that having just to work with one doctor, I was like, okay, and he was fast. We had a lot of rooms.
Right.
But I was able to come up with my own, I don't know if it's my ADD, and able to multitask. It wasn't extremely difficult. There were days, don't get me wrong, but for the most part, I prefer that than just kind of, sitting and waiting and,
Yeah, from what I remember, was he doing 1 hour crown appointments?
He was doing everything, almost seemed to have like the same time. I feel like everything he had scheduled almost on like 30 minutes, where it was a 30-minute crown because he was basing it on how much time he was going to be in the room.
Right.
And he knew that he was only going to be in there maybe 15 minutes from start to finish.
Right.
And because he had 4 rooms and 4 assistants, sometimes 3, depending on, the time of the year, he would just kind of dip in and I would do, and any of the assistants that were there, they would do their work in the remaining time, almost, I make a temporary. We took impressions, so we didn't have, like to wait on scanners. We didn't have to pack cord because he used to use an electrosurge when he was prepping that would kind of, burn the tissue away. So that was another step that as assistants we didn't have to do. So ultimately all we had to do was wait for the impression to set and make a temporary. And that was it. And over time, we were just really strong and fast at making those temporaries, that they were out almost in about 45 minutes.
So how did you learn to balance then giving the patient enough time and talking to them like you were saying versus working with the dentist who's working fast?
Yeah. So it would start from the moment I would bring them back. From the moment I would bring them back and I'm bibbing them up, I was just already engaging in conversations and stuff. And when the doctor was working on them, I would sometimes, reassure them they were okay. If they needed I was the one that was like, if you need a break, you just raise your hand. If you feel like you got too much water, you need another break, raise your hand. When they were biting down in the impression, I would be cleaning the room up. And while I'm cleaning the room up, I would be, still talking to them, maybe telling them about stuff about me that they didn't have to like respond to necessarily. And then while I was making the temporary, now they have nothing in their mouth. And now that, we're both just sitting there talking, so are you off today? No. Oh, that's great. Yeah, I am working. Well, I can give you a note so you don't have to go back to work, and just like little things. And we would talk about, maybe their kids, picking up from school, what activities are they in. And if they had kids, that was almost like my gateway because I had kids. And so now we can talk about our kids.
Yeah.
And then by doing that, when they come in the next time, we're already familiar. We've already now starting to build on that. And so we just keep, how was your kid's game? Was it great? Right. How was, and it just kind of snowballs. So, you don't have to have necessarily all this extra time just to form a relationship because there's plenty of time while you're just in the room with the patient, just talking, able to talk.
It's funny you say that about the kids because I feel like now when I go to different offices, that's all I talk about. And I don't even know what I talked about before that.
It's crazy. Yeah. No, it's very true, and now I'm noticing that that's kind of phasing out for me. Or now when I'm talking about my kids, it's almost like I'm talking to people like, oh yeah, I remember that, when my kids were small and, it makes me a little misty eyed, when I think back to that. Right. But because now it's a whole nother, season for me with my kids. But
how did you learn to balance when to be quiet and when to talk versus different patients as you're reading them?
I think that's it. I had to read them. I had to gauge, like if I would initiate a conversation and they weren't giving me much back, okay, I know that they're not, really, feeling this. Or I would still try to conversate and just be more like, so is there any questions about, today's procedure? Do you want me to, help answer anything, or any concerns that we can go ahead and knock out before and bring it back to like more dentistry and not that personal, side. Right. So it was just kind of seeing what they gave me and then just going with that.
Did the interaction give you confidence when you're presenting treatment to them?
For sure. I, again, I like talking, and I don't know if I have a little, knack for, bringing things out in people, for conversations, finding something. But once I had that relationship, I kind of felt like I had that trust with them. And so whatever I was going to present to the table, they truly felt like what I was saying was in their best interest. It wasn't that I was just some random person just coming in and this is what you need, this is what you need. I just did it the other day where a patient, she's got a very busy schedule and she's always like, work won't let me and, my kid's schedule. And so when I started with the treatment, I was like, look, I already know, I'm sure you got a game that you got to go to, I know your boss is probably, but you need to let your boss know that this tooth, it's going to make you call out, so you're going to miss a day regardless. So maybe you should talk to your boss and try to see if you can work with him on scheduling a day that you can take off rather than you having to call out because it's coming.
Mm-hmm.
And then she was like, yeah, you're right, and just kind of, but it's knowing already that she's got a hectic life, she's got a hectic schedule, and
Mm-hmm.
kind of letting her know that I'm aware of it. So it's not like, you know, I don't know. I don't know. It's I know what her life is like, and
Right.
so, but at the same time, she's got an important situation going on in her mouth, and it needs to be addressed.
Right.
Essentially, if it was your heart, if it was anything else, you would go ahead and you know, you would go to the doctor.
Right.
People for some reason think that when it comes to their teeth, it's not as important until it knocks them down and they're not able to,
Mm-hmm.
come in or function. So,
How do you handle if you're treatment planning a patient? The like, say something about the patient, or you just they tell you like I can't afford this, or whatever the difficulty is. How do you navigate through that?
so first off, also I kind of read the patient,
Mm-hmm.
have a little conversation to see if, they are planning those big vacations and stuff like that. Once they start saying, well, financially I can't do it, I was like, well, what is it? What is it that you can't do? I'm here to help you. I want to make this as easy as a process for you. Is it something that you want to break up in payments? We do offer, and I tell them, like if it's a crown, we offer, 2 payments. I've been presenting Sunbit a lot,
Mm-hmm.
And that has been working. But I also do prepayments. I tell them, look, let's go ahead, let's get you tentatively on the schedule, and I usually give them maybe for those that it's like maybe a root canal and a crown, and they're just like, I can't, it's just too much money, and they
Right.
don't have insurance. Then we will, if you'd like, you can give us a call every week when you get paid. This is on you. We're not going to hold you to this, but if you want to say, hey, Shelly, look, I just want to go ahead and pay $50 today towards my treatment, boom, $50. We're slowly chiseling away at your balance. And by the time you come in, whatever your balance is left, we can still break that up into two, but at least we're working towards and we have a goal. And I do have, some patients that are like, yeah, and they call me and they're like, hey, I want to go ahead and put $100,
Right.
towards my. So that, and then also like if I have a patient with a lot of treatment, and they might need just one root canal and one crown, and if it's in the back, and if that's going to run them almost $2,000, to fix that one tooth, I kind of explain, we're in the business of fixing teeth. However, if this one tooth is going to take all that you have and the rest of your teeth are going to suffer, that one might have to take it for the team.
Mm-hmm.
Let's go ahead and let's put your money towards, and even cash or insurance, let's put your money towards all the other ones that are more financially easier to do. And then we'll see when we're done where this tooth is at. You might still be able to fix it, and now we can focus on that. Or, that one might have, take it for the team. Of
Mm-hmm.
course, I discuss this with the doctor first. I don't, just make that judgment on my own.
Right.
But a lot of people then focus on that because I think sometimes we need to remember that even though a doctor may say 31, that's the priority. That's it, Okay, that's a priority for you. But as long as the patient knows that is your priority, that is your focus, because that is the one that will probably knock you down and cause you the most pain. Ultimately, it's your decision, it's your mouth, and you need to do what's best for you financially, and emotionally. Some people just don't want to do root canal. They don't want to sit through that. They don't want to,
Right.
they hear horror stories, and, or they've lost another tooth that was root canal treated and they're like, I don't want to deal with it. So it's just balancing, listening to the patient on what they want, and kind of like coming to a compromise between them and what the doctor's recommending and what they can afford.
Right.
So,
How do you work with the doctors then on this?
um,
How does it work in your office?
so, for presenting treatment or
Yeah, presenting treatment and just talking financials with the patient, and
Mhm.
just having do you preheat the patient? Like, what's the process of like a full treatment plan?
Okay, so I usually go in after the doctor has done the exam. The doctor, sometimes, well, a good portion of the time will come up to me and say, hey, Shelly, we need a treatment plan. It's, this, and this. And, I'm like, all right. And then I'll pull up the x-ray real fast so I can look at the x-ray, because I like to be able to, go in there with all of my information,
Right.
so that I can explain it to the patient. So I go ahead and I pull up the x-ray, look at that. I will sometimes go to the doctor in advance, even before I see the patient, just be like, okay, look, I see that they need a lot of treatment. Are you okay if I suggest this, this, and this? And I say 90% of the time, they're like, do you?
Mm-hmm.
We trust you.
Mm-hmm.
So that's when then I go in and, I introduce myself, and, I'll try to make that small talk, oh my God, I love your sneakers, and, I'll take out their sneakers, and then I'll show them, like my Converse, and,
Mm-hmm.
we'll kind of talk, and, so, the doctor came in. Do you have any questions about anything that he recommended for you? Any concerns that I can help answer before, I talk? And sometimes they're like, no, I'm good. And I'm like, oh man, really? Because that's my forte. That's what I love doing. This financial part, I don't really want to go right into that. If there's something that you want to, talk to, but about teeth,
Mm-hmm.
and then they'll be like, okay, well, yeah. So and whatever there is that, whatever it is that they're asking, I'll have the assistant put it up on the TV. So I have the X-ray, or I'll have the scanner, and I'll kind of like just do a quick recap of whatever it is that the doctor had recommended. And then I'm like, okay, so now, now that you are fully educated, this is how your insurance works. And then I'll tell them this is what your total fee is, and I like to go that way first, because when they see that large number, and then they see now, okay, now this is what your insurance covers. They're like, you can see like they're a little bit like, okay, the covers. I said, and then we give you an additional discount. And I said, and this discount is, whatever your contracted rates are, and then they see a nice little chunk again, of a discount. And then, and now this is your, your final payment. And then if it's a large treatment plan, I will tell them, don't be overwhelmed. I don't want you to look at all this. We need to remember, slow and steady wins the race. Right now we're just going to talk about these two teeth, and once these two teeth are done, depending on how quickly, you're able to come back and get it done, then we can go ahead and move forward with the next, the next two steps. Because sometimes if you present too much treatment all at once, if it's a patient who is tight on money, they may take a minute to come back. And now you've spent a lot of time treatment planning teeth or procedures that are changing, and they're not going to be the same, because now it's not a filling. It might need to be a crown,
Right.
or now the filling is a bigger filling, or just other things. So I don't really like to go too far, because I think it overwhelms them.
Yeah.
And things change. Things change. So that's kind of how I do it, and then, after, they understand, I ask them, are you okay with, these numbers? Is there something that we can do? And I'll have those. They're like, no, that's great. Let's go. And I'm like, solid. Let's, get you scheduled. What days work good for you? And then, I just kind of wheel myself into the computer and kind of, put out your calendar. Let me know what works for you, morning, afternoon. Is there a day of the week that's the best for you? If they're kind of like, oh, okay, well, I might have to wait on this. I'm like, okay, so are we waiting because of, schedule? Are we waiting because of finances? What's the reasoning, so I can see if I can help you on that. And then that's when, we'll either we'll go into the route of, you need to tell your boss, you need to, get a day off, or, we have options for you,
Right.
and my first option is always like the breaking it up into two. If it's a procedure that is a two-step procedure, then my second is Sunbit. And then my last one is the payment plan. And I do that for those who don't get approved for Sunbit, or don't get approved for the right amount of Sunbit. Although you can kind of play with that also, because like if it's one procedure, and they can get approved for instance, if they only get approved for like $400, right? I'll explain to them, look, once you pay this off, this is a beautiful relationship that you can make with Sunbit. Once you pay that $400 off, all we do is we scan your driver's license again, And because you've built a great relationship with them, they'll give you more, more credit to use with possibly more months with zero interest. I said, so this is a beautiful thing for you to keep in your back pocket, down the line if you need to have, work done. And I do have patients that will go ahead and take just that $400, Sunbit thing and put it towards like their 2 fillings. And, they'll do the 2 fillings and then they'll come back and they'll try it again. And then it is, they do get more. And
is it more difficult treatment planning not being the assistant with them the whole time and coming in from the front?
It is something that I had to learn because, as an assistant, I was there and I heard the whole conversation from start to finish.
Right.
But I think because I know the procedures, I know how the doctor works, I know what I'm looking at in the X-ray. It's really not that hard for me. Maybe in the beginning it might have been because I didn't like that people were referring to me as the money girl. I didn't like walking in and and they say it to you. Oh, here's the money girl. She's just here to talk, money. Yeah. And I would be like, whoa.
The team was saying that?
No. Patients would say that, and so I didn't like that. I didn't like, I don't want to be referred to the money girl. My passion is it's helping you and fixing your teeth. That's my passion. My passion is assisting, talking about the money and everything now is default because, of where I'm at, with my hands. But, again, I gauge them and I just let them know that I'm here to help them.
Yeah.
And if I have any questions about what went on in the room, I will turn directly to the assistant and I'll be like, hey, what did the doctor say about
that's a good idea.
this, and this? And, then they'll go ahead and, they'll tell me.
So what if you have a front desk who has no clinical experience, who's just started at your office, and that person is coming back and potentially doing treatment plans, like if you're busy or not there, like what is the basic advice you're giving them?
I probably would say make sure you speak to the doctor first so that at least you're going in and giving the patient the same information that the doctor left the room saying. And probably also not focusing too much treatment, but just focusing on the very next step. If they're just kind of stepping in, while a treatment plan coordinator is unavailable. If they are going to be taking on treatment planning, then I would say, that they would also need to talk to the doctor. I think that they should be preheated by the dental assistant in the room. And I feel like if a patient was to ask a question, regarding like the procedure, or to just have the dental assistant be right there to step in and answer the questions for that.
Do most patients have questions that they're scared to ask?
Some do. Yeah, some do. Some I think feel more comfortable talking to the assistant rather than the doctor.
Right.
And I think it's just because they feel that the doctor, he's of a higher level. And sometimes I feel like some of them don't want to disappoint the doctor by saying, well, I can't do that, or, no, that's not for me.
Right.
They rather tell the assistant, no, that's not for me, or no, I don't need that, rather than, saying it to the doctor.
What's the difference in treatment planning on the doctor side versus the hygiene side? If a new patient is only seeing the hygienist that day?
So if they're only seeing the hygienist, it doesn't really change for me, again, because I know the procedures, but I think it would make it's a little bit more tough if it's a person that's treatment planning who doesn't have a lot of the dental knowledge, like the knowledge of the procedure. And if you have a hygienist who doesn't know like the procedure of, from start to finish with the doctor, if a patient has questions in the chair, I think it makes it a little bit more tough. Because you have a hygienist that, she'll tell you all day long, about the gums and pockets and, medications for that and how to clean that and how to fix that. But she may not be able to help you or a treatment plan coordinator give the details of the process of a root canal. And so if a treatment plan coordinator is presenting something like that and a patient has questions about that, that would make it tough. But I would probably recommend at that time saying, just a minute, let me grab an assistant and bring that assistant over and have that assistant, go over that procedure for the patient if they had questions about that. And if not, I would say also for the hygienist to make sure that she is aware of what the doctor recommended for the first procedure.
Right.
We always want the patient walking out the door knowing what their next step is.
Right.
And I think as long as they know what the next step is, then we're good.
Mm-hmm. What would you say that some common mistakes that you see or hear are from other people if you're not the one either presenting the treatment or just like things you hear in the office that are just make it more difficult to treatment plan?
I think one of the things that makes it difficult is when you say, oh yeah, you have a small cavity. When they hear the word small, they're like, meh, forget it. It's tiny. It doesn't bother me.
Yeah.
So I'll just wait till it's big and it bothers me. So I have had many conversations, and the doctors are great now as far as, please do not say you have a small cavity.
Mm-hmm.
It's, you have a cavity, also kind of like giving time frames. Sometimes, they'll give time frames on stuff. And I don't like when they give time frames, because when you give time frames, they kind of hold you to that, and that might prevent them from, wanting to move forward to treatment.
Right.
And I hear that a lot. I hear patients in the chair going, so how long do you think I have before I need to, worry about this? And then, a mistake would be, well, it doesn't look like it's close to your nerve yet. So, I'd say, maybe we can put this as a watch and just wait till, your 6-month cleaning. And then, no, if it's suspect and if you see it, you need to say, I think it should be addressed as soon as you're able to come in. It's best situation right now. It's cheapest situation right now. The
Right.
longer you wait, the longer you wait, the more expensive. So I think just making people understand that it is a necessity and not something that's just, it's small. I hear that I think was one of my biggest things that I would hear in the beginning. I don't hear that much anymore. Another thing would probably be this might be the battle of the hygienist and the assistants. There's always that kind of is, of course, hygienists are very focused on the health of, the gums.
Mm-hmm.
And in the end, that is the solid foundation of the teeth. If you don't have good gums, if you don't have good, hygiene, the work that we do kind of is for nothing, because the teeth aren't going to be held in, right? But I think it's sometimes where you need to realize that maybe the hygiene schedule is so booked, right? And they're really recommending that deep cleaning, but the patient can't come in maybe for another 3 months because you're so full, because you're that good, of a hygienist that you're booked. So now you've got a patient who has teeth that need to be fixed, and they're holding off because they need to get that cleaning first. I feel like you just need to get whatever's available, whether it be on the hygiene schedule, on the doctor's schedule, you just need to come in and get started. And that was, I think, a little bit of maybe an issue when you didn't have like a treatment plan coordinator, and when you just had everyone in the office treatment planning the patients for themselves.
Right.
You had the assistants that were focused on, bringing them in just for the dental work. And then you had the hygienists that were focused on, getting them in just for, the cleanings. And,
right.
And then it would kind of cause a little conflict, because while you're waiting for that 3 months to get in for that cleaning, that cavity that you had now is getting larger, and generally they won't schedule for that cavity until after the deep cleaning's done.
Right.
Right. And a deep clean is a 2-step process that if you're on a full schedule, if they have to wait 3 months to get in with you for that deep cleaning, and then now they got to schedule again for the other half, that could be a good 4 months.
Mm-hmm. Is that the point where you bring the doctor in
for
to see what the next step should be?
Yeah, kind of. Yeah, I've had where I had one particular doctor that he's wants to get that cleaning done first. I will go ahead and let them know, hey, I know this is what you recommended. We don't have anything, until this date. Can I schedule this patient to come in and let them know it's okay to get, this crown done, like get this extraction done? Like, let's, we have availability on our side. Let's bring them in. And then, I think maybe just a couple of times I've been told, no, they need to have a cleaning first, and it is what it is. And so it is what it is then, at that point.
Do you have any advice for dentists besides the, saying it's a small cavity or like, hurting the urgency of the situation? Do you have any advice for dentists for how they can make it easier for the assistants or whoever's presenting the treatment?
I think before they leave the room, or I think first they really need to explain everything to the patient as to what they need and why they need it, because assistants can say all day to them, or I could say, what they need to have done. But there are those patients that unless it's coming from the doctor's mouth, it doesn't matter. If he didn't really make it seem like it was urgent, well, then why are you making it seem urgent? You're just wanting to collect my money. You're just wanting to go ahead. So I think it's letting them know, hey, if I don't see you soon, this tooth right here, you see this, you're going to need a root canal. Hey, this tooth right here, it's cracking, it's breaking. Right now, we can fix it with a cap. But if you wait, we're just kind of crossing our fingers that if it breaks on its own, we can still fix it, with a crown and not needing a root canal. Or, worst case scenario, you'd end up losing that tooth. I think it's them stressing the urgency to the patient, and then before they leave the room, verbalizing it to the assistant so that the patient hears, next step, I want them to go ahead and come in for X, Y, and Z. So now the patient's sitting there going, oh, he said, this is what he wants to see me for. And then it makes it easier so that when I'm doing priorities as to scheduling the patient, so he did say this to you. Do you understand why? He did tell me that he really wants me to get you in because he's concerned. He doesn't want to make this a bigger procedure than need be. I'm sure you don't want this to be a bigger procedure than need be. Let's get it done. So I think just stressing the urgency to the patient. And I'm not talking about like fabricating stories. And I'm not about, wanting to scare patients for no reason, but I feel like in any form of medicine, if it's something that will get worse, you need to make them aware. Because again, if it was something elsewhere in the body and a doctor's telling you, hey, I need to see you as soon as possible, get this blood pressure under control, or I need to see you as soon as possible, whatever the case is, patients are going to take it serious, and why not use that same, seriousness when it comes to your mouth?
Right.
So
when you moved from clinical to upfront, what was the most difficult part of that for you?
I think I really enjoyed being with my doctor. I love having that dance, assisting. I like that. And especially working with the doctors that I have now. With the doctors that I have now, they were very open when I would verbalize something. Because again, as assistants, we are that second pair of eyes. We're there to see the things that they possibly can't because of certain angles, that they're sitting in. And I just loved knowing that I contributed to saving that tooth. I liked the constant movement, the conversations. In the front, I still have those conversations. When I check out a patient, I have those conversations stuff. I think the hardest part was just the computers. I'm not very computer, savvy. I worked all those years, in all the private practices with charts. And again, being an assistant, I didn't have to learn anything computer related. Insurance, that it's not fun for me.
Mhm.
I didn't think I was going to really be able to learn it the way that I needed to learn it. I liked it before where I had a front desk that was giving me my treatment plan and then I go and just present it. Now I am verifying that everything that I'm presenting, that the fees are correct, and paying attention to, waiting periods, maximums. There's a lot.
Mhm.
So I think I enjoy it, but I think it's a little bit more stressful because I'm dealing with a lot of numbers, I'm dealing with a lot of money,
Right.
and I'm dealing with other people's money,
Mhm.
and that for me is a little stressful and not as fun. But
Yeah.
I feel like I'm actually kind of surprising myself because I really didn't think that I was going to be able to do it.
Mhm.
uh, Especially with the computers. I'm just, what do you mean I gotta download something? What is that? What do you mean it's in Google Docs? What is that? Frankie, where's this? Oh yeah, it's in your drive. What is a drive?
Mhm.
I was just really, but now I realize that it's almost no different than assisting in the form of repetition. I just got to keep doing it, and the more I do it, the more it becomes easier. And now I know where that drive is, I know where that copy and paste, and I know how to
Mhm.
attach emails. And I'm learning that end of day and stuff that really freaked me out. So um I think I'm just I my heart will always be with assisting.
Mhm.
um but honestly, I think my heart is just with my office
Yeah.
because I'm thankful that I able to stay in my office.
Mhm.
I was really concerned that when my time for assisting came to an end, I didn't know what I was going to do with my life, because that's all I know
Right.
was assisting. So this allows me to stay, do what I love with the people that I care about,
Yeah.
patients and staff. So, yeah.
What do you like? What knowledge transferred up to the front and made the front better, since you had the clinical knowledge that the other team didn't?
What made it better?
Yeah. Like what did you bring to the front that maybe you didn't know the front was missing,
I
like
don't
from
know.
the clinical side?
I feel like that's a question for my front desk staff to know what I brought to the table.
Well, what did
Um,
you what have you seen any changes from how the front is handled now that there's like
yeah.
an assistant there?
I think maybe a little bit of change might be that now when we get those phone calls with those patients who have questions about the treatment or are hesitant, I'm able to go ahead and talk them through the process.
Hmm.
Where maybe before, it was kind of like, well, when you come in, the doctor can answer those questions,
Right.
or something like that. I think I'm able to give them that information that they're looking for on the phone or at checkout
Hmm.
or prior to checking in, if they have any questions. Because I do have some that they come in and they still don't know if they want to get the work done,
Do you see potential problems you're able to head off in the front before they get to the back, and you just like, oh, I've seen this before. I know I need to act this way.
Mm, ye- yeah, I think maybe it might come with just me having a history with some of the patients and knowing, them and what they're going to try to bring when they come in. And so I'm already letting the assistant know, hey, this person, they seem real tough, they seem real angry, this is what they like. See if you can go ahead and tap in on that. Once you can tap in on that, they will soften up somewhat,
Hmm.
or hey, this is a patient who's very firm. When you talk to them, you need to talk to them like, this is it. This is Bible. You don't go in there questioning yourself, because the moment you question yourself, they go in for the kill, the patients. The moment an assistant, I feel, or a doctor or a treatment plan coordinator or anybody, the moment a patient picks up on they are not confident,
Mm-hmm.
they don't sound like they know what they're doing, that's when they kind of go in and I call it going for the kill, to where they kind of chew you up. And that's when an assistant's like, I don't want to work on them anymore because they made me super nervous.
Yeah.
But if you sound confident and if you know what you're talking about and you reassure the patient, you're fine. So there are patients like that. And I tell the assistants, in advance to speak.
How long did it take you to get that confidence from back from when you started?
I think, Matt, it's kind of weird. And it's not like, I've always kind of had myself a little bit of confidence, kind of like with whatever I did. And I think it was always, like even in high school, I was always like, fake it till you make it. You know what I mean? As long as you present yourself, that's how they'll see you.
Mm-hmm.
And then I think once in the dental field, once I had so many doctors that I had worked for in the past, I was able to pick up certain techniques that, over time, that you're like, okay, so this doctor's doing this, that worked really well. There's this doctor's doing this, it's not working well. Let me go ahead and see if I can tell the doctor this new technique that I saw or not. And then if a doctor is receptive, I think it helps to give me that confidence. It's like, okay, he trusts me, and then whatever he did, and if it worked, now I'm like, okay, that worked.
So you're saying that the doctors giving you confidence transferred over to confidence with patients?
Yeah.
Interesting. Okay.
Yeah, because if they trust me,
Mm-hmm.
and if they trust me, and I hear that a lot. I trust you, Michelle. Whatever you think, Michelle. You know what I mean? And I think that came with me having those conversations with my doctors. I've sat on the floor in their offices, and I was like, hey, what do you think we could have done with this? Or what could I have done better with this? Were you okay with me saying this? And having that relationship with the doctor to where he's seen my work. He's seen that I've kind of proven myself with my maybe suggestions, that when he starts saying, whatever you think, Michelle, I got you. It's like, yo, okay, and then now when I'm talking to the patient, I'm like, in my head, I'm like, I got this because my doctor knows I got it. So I got this. So yeah.
Interesting.
Mm-hmm.
So let's say there's an assistant who's maybe newer to assisting, new to your office. They're coming in first week. What general things are you telling them, and like what are the main things they need to focus on?
Building a relationship with the doctor, asking questions, ask. When Dr. Tarver came in and when Dr. Wasson came in, and I was chairside, I would be like, do you want me to dry that tooth? Is that dry enough for you? And then he would say, no, can you dry it more? Okay, got you. Do you want me to go ahead and retract the tongue? Would you like me to, like just verbalizing stuff? And he would be like, yes or no. And the only way that you learn from your, what your doctor wants, and to be able to do that, I call it a dance, you have to be able to ask those questions. Don't wait for him to tell you, because I feel like when you wait for him to tell you, it makes it seem, or maybe it is, that you don't have that, what is it? You don't have that desire to please him and show him what you got. And in the end, it's about the patient and how can we work on this patient as easy and as efficiently as possible. And if you don't talk about it, then you're basically both fighting in the mouth. Right. So my biggest thing is just talk, ask, and if you don't feel comfortable in the room asking, in front of a patient, after the procedure, how was it? What do you think I could do better? But then you also need to make sure that when the doctors are being asked, that the doctors are being honest. Because I feel sometimes that a doctor feels a certain way and they'll verbalize it maybe to others, like maybe to me or our manager, but they won't
They don't want to hurt feelings.
hurt. Yeah. And I don't feel like it would, I don't know. And maybe I don't feel like it's hurting feelings. It's that we have a job, right?
Mm-hmm.
And if I'm not hearing it as an assistant, if I'm not hearing it from the doctor, then I may not take it as it's really an issue with the doctor,
Right.
because he's not telling me. So I feel like once the doctor says it, that's bing. Hey, he told me, so this is what I got to do. This is what I can't do, or whatever. So I think in the communication, it's important that the assistants be honest with the doctor, and that the doctors be very honest with the assistants.
Mm-hmm.
And you can do that. You can do that professionally. You don't have. I mean, if a person takes it too personal, sometimes that might just be on them.
Right.
In the end, my goal is patient care. So.
Yeah. Do you have any advice for the front, like how they can get more, since they haven't worked in the back, like what are the basics that a front desk should know coming in?
Coming in, well, I guess the basics would be they would have to know how to find Google Drive, right? They would need to find that. But I think it would be also forming a relationship with the patient when they come in.
Yeah.
Because we're the first face that they see. And if when they walk in and if they see us kind of like pulling our hair and stressed out, or, just like rolling our eyes because we're on a phone call, that's not really something that, is very welcoming and making a new patient feel comfortable. So I think it's just really trying to remember that as a front desk, all eyes are on you initially, and trying to build whatever relationship you can with those patients that are sitting there,
Yeah.
in the waiting room. Sometimes I've stood up and, there's something on the TV and I was like, did you see that? That looks really good, and then they'll start talking about, because it's the food channel. They'll be like, oh,
Right.
yeah, that's got me really hungry, I think, and it's just like little stuff that kind of makes them, feel like notice that, oh, they do know that I'm sitting here, and,
Well, thank you so much for being here.
Thank you.
This
for
was super
having
helpful.
Me. Thank you.
And you said something earlier about just helping the office. Like, just want to say, like, it's amazing to see your journey and transition to, from the different roles, and how like each one is just like you've gotten better and better. So I'm super excited to see the future there with you.
Thank you so much. I appreciate the opportunity, and I'm very thankful again that you guys were able to try to find something, that you felt I could do, and that would help the practice. And I feel like I might have found, my little niche here, after assistance.
No, you're doing awesome.
I appreciate it. Thank you
Thanks
so
so
much.
much.